So we're going to continue talking a little bit about clinical interviewing. We've discussed a lot of different aspects about clinical interviewing, but our objectives for this segment will be talking about the physical dimensions, looking at seating arrangements, our note-taking abilities, as well as that famous video audio recording that we may do. Now, in terms of physical dimensions, of course, we're talking about the assessment environment. You know, it's really similar to a therapy room. However, with the environment, testing environment, it also has to be conducive not only to that clinical interview, but being able to make assessments go easier. So Summers and Flanagan, they kind of discussed the following different facets that should be considered, that being privacy, decor, and control. Now, when we're talking about privacy, of course, this is an essential component. When we're working within an office, uh, we should have a do not disturb sign if at all possible to protect what's being said in the room. You may want to utilize a white noise machine that would help to avoid any information being heard outside of the room. In terms of professional decorum, of course, that's an important feature as you want to be able to create a safe haven, so to speak, for your clientele. Summers and Flanagan, they talk about how it's important to be able to strive to have an office that's going to be diverse within a range of different people and making it where it's comfortable for someone to come and be able to share their most intimate part of their being. So we have to pay attention to those messages that what our office would portray, or even the waiting room. If you notice, most waiting rooms, being that in the clinic or in other facilities, it's going to have a serene environment, hopefully, so that people, the level of anxiety can be reduced and they're not going to be feeling overwhelmed. So you want to be able to provide reading materials that's actually going to be diverse, being able to represent all cultures and not just simply one. One example that we want to consider, Summers and Flanagan, they talked about Native American clients, and it kind of reminded me about when I worked in Alaska and was working with Native Alaskans, in that my office had a culmination of different cultures. I demonstrated the Yupik culture, which was uh, basically the majority of Native Alaskans that was within that region that I worked at, which allowed them to see that I cared about their culture as well as my own, which, by the way, I also shared and had Afrocentric type of materials. And pretty much it allowed for them to see that I had a sensitivity not only to their culture, but wanting them to learn and understand my own culture. Uh, Pretty much what your office need to do is, in terms of multiculturalism, build awareness on all sides. That being through the exposure or training, or as well as even supervision, which Summers and Flanagan suggest in their text. Now, control. Now, this one here is your probably one of your biggest facets that you have to be able to set up and set it up appropriately. That from seating arrangements, be in control of how you're taking your notes, um, all of it actually. You have to be in control, but you also want to give empowerment to your client. So both you and your client should be able to have an ability uh, to, in terms of seating arrangements, feel safe that that you or they can leave at any time. So more times than not, usually in a setup of most uh, rooms, you want to kind of have it where you're close to the door, okay? But you don't want to be blocking your client from access to the door either. More times than not, what you want to be able to do is establish safety rules, okay? And that being starting with the seating arrangements. Uh, Believe it or not, you can actually help to establish rapport with your seating arrangements. That being, Your client wants to know that at any time they can be able to get up and leave if they feel that uncomfortable. And you don't want to present yourself as, I'm going to stop you. No, because you're blocking the door. So you want to be able to keep that door in a place, hopefully that the room isn't so small that you're automatically blocking it, but that you're going to be able to, for safety reasons for yourself, in case of a client becoming aggravated, agitated, aggressive in any type of way, and you fear for your life, able to leave the room. But if it's where the reverse happens and your client's just feeling so uncomfortable that they can get up and leave, by them seeing that you're not trying to block them in, it, believe it or not, has that psychological effect that they're not, they can actually trust you somewhat because you're not trying to force them into something they really don't want to do. So there's a couple of different ways seating can happen. You can actually, Sommer-Flanagans, they speak about the 90-degree seating arrangement, where the seats are kind of not directly, you got one side to the other. But a lot of people, including myself, like to do face-to-face interactions. Okay, so I tend to like to have maybe that 45 degree. I want us to be able to face each other a little more closely, so that I can truly connect with the client. But there's also the big possibility that besides your clinical interview, you're going to automatically run into, as I was saying, you want to also be able to, make sure that if you're testing a client, that more than not, you're going to have a desk in between you. So you want to keep it as comfortable as possible because unfortunately that is a necessity. You're not going to want to do an assessment and not have the proper tools available. Um, but other things to consider: lighting in the room. When you're doing testing, you don't want the client, as they're doing testing, to be facing a window that is shining oh so brightly, because what's going to happen? You're going to actually hinder your testing results because the sunlight may be interfering with them during the assessment process. Other things that you need to think about, one thing we've complained about already within the classroom is the temperature. So, if it's too cold, it's going to influence not only the clinical interview, but it might the overall evaluation. So you want to try to diminish or reduce any type of extraneous variables that might get thrown into the mix so that you can have the optimum experience with your client. Other things that you want to keep control of is being able to make sure that there's no devices like phones or, iPads. I know I have a problem with the iPad that now I put do not disturb on my iPad because it was synced to all my devices, that being my iWatch, my iPhone. So anytime they would ring, even if I put them on, silent, my iPad was going off. So now it's where I have that on do not disturb. So you want to check all devices so you can avoid any type of interruptions. So knowing that you have these, you're going to have some interruptions. There's no avoiding that. Interruptions that you can't avoid is having to take a bathroom break. Sometimes a client in the middle of a discussion says, I'm sorry, can I go to the bathroom? Of course, you need to allot for that. Or, you know, they may become ill during their time with you. So we're looking at in controlling, of course, we can control how the seating arrangements are. We can control how the sound is going to be. We can control how how the flow of the interview will go. So you want to be cognizant of all those different areas. Okay, so when it comes to note taking, basically in our days and times, there's two ways you might do it. You may do it the classical way of using pen and paper, Or you might have an iPad and be jotting down using uh, the iPad as a way of taking your notes. Well, of course, there's been controversy in terms of how you would be able to. There are some therapists and some clinicians who feel that in therapeutic environments for psychotherapy purposes, that you really shouldn't be taking notes. Whereas others feel that, well, by not taking notes, what happens is you might forget something pertinent that should be relevant to the case. And because we don't always remember everything we hear, sometimes there's a lot of speaking going on. My rule of thumb is, particularly because you may be a new clinician, take notes and express to the client that you're taking notes. Don't leave them in the dark and make curiosity wander. Give an explanation that, and also get assent that, let them, acknowledge that you have to take the notes and that they agree that you do so. You can ask them and let them know, well, look, in order for me to be able to service you better, it would be really important for me to take down information that you give me so that it helps me in terms of being able to diagnose as well as be able to service your any type of situation that's going on. The better I take notes, it's actually going to be better for your therapy, or in our terms, since we're talking more about assessments, it's really important that we get down everything. The more information that we have on a person, the better we'll be able to assess their particular situation. And that's something you would want to cover with them. So some rules to help guide you that Somers-Flanagans speaks about is that you shouldn't allow the notes to interfere with rapport building. With that being said, by introducing the note taking at the very beginning, this allows for some reduction of anxiety that might be building, because think about it, you're talking to a person and they're writing, okay? And this part is a hard part because you don't want to lose that connect by constantly looking down at your pen or paper or down at your device and never giving complete eye contact. You want to try to make sure you keep that established. So sometimes what you may want to do is listen for a moment and then kindly say, okay, you know what, Mary, I'm going to take a moment and I'm just going to jot down what you finished, just what we just finished discussion, if you don't mind. This way, you've been able to maintain contact, eye contact. You will enhance those listening skills and be able to allow the client to know that you are really there to hear them. Okay. Uh, of course, I already told you about the explanation of note taking, but do share that constantly throughout. You want to be an open book. So don't try to hide or cover up what you're writing, because guess what? Your client is going to start becoming suspicious. Your client's going to wonder, what are you writing? And that will help to break up the rapport. It may form mistrust, or it's going to be a distractor in that the client now is really thinking more about what is it that he or she is writing about me. So you want to be an open book, never hide or cover up. And do stick to the facts of what you're hearing. Sometimes we start developing or interpreting information, even though we haven't made a full assessment yet, and we tend to want to write that down. You want to kind of avoid that and simply go by the facts, because guess what? If you write opinions and you have nothing to substantiate it with, your client might see what you're writing and then going to wonder, well, why do you think that about me? So you want to avoid doing opinions and sticking mainly to the facts. Also, if your client asks, can I read what you're writing? Don't say no. Please don't say no. But you grant them the right to be able to read it, but be prepared to be able to explain what it is that you're writing. Also, be sure to ask about any concerns that they might have about what they've read, and explain the process, because we'll be using jargon that they're not accustomed to. So you want to be able to explain that information as fully as possible. And then go back once again and reiterate why you're taking notes in the first place. Again, we are, just as last week, we're continuing to speak about the process of using video or audio recordings, okay? So, more or less, first and foremost, we have to obtain consent, all right? It needs to be prior to your recording. The recorder or the video camera should not be playing until your client has signed on a dotted line. It should be without coercion. And just a side note, although unfortunately I wasn't there for the clinic meeting, I did still let the committee know of your concerns. I did write the director of clinical training, Dr. Schweitzer, as well as inform Dr. Moreland of concerns that's been expressed. Of course, I did not share names. I just said of those working in the clinic. So I have protected as much as possible. But in terms of this particular area, it is something that is going to be looked at further and will be further discussed, particularly within the next meeting. However, as your instructor, I am instructing you in terms of ethical boundaries and ethical, that I'll go through some of the ethics that codes that I looked up. We should do this without coercion, okay? Then there should be a full explanation of what it is that the recordings are going to be used for. Now, because of we're being in an institution, the group process can be allowed, but it should be explained, and we need to look at whether or not we're including that on our consent forms. It should be something that's added. So that is something that we will be looking at. But you should still be giving a full explanation. If it's merely just your supervisor seeing it, then you would say merely your supervisor. But because we're in an educational facility, you may include that those in your cohort, other students, may get to watch this for learning purposes. So you want to be able to provide a full explanation, okay? Record explicitly but unobtrusively. You want to get everything that's going on, but at any time, if a client feels uncomfortable, turn that machine off. At any time, okay? We can't force them, and you want to be able to be matter of fact. That in talking about the process of what you'll be doing with the taping, to the process of while it's taping. You want to talk about the equipment, share with what type of camera you might be using at that moment. If you're using the audio from your iPad or from your iPhone, which you should avoid doing that. And the reason why is that's more susceptible for information getting leaked out. Hacks happen all the time. An old-fashioned tape recorder is what I recommend most. In terms of continuous oral consent, like I mentioned last week, every time you go back to recording a session, if it's a new session, it should be an assent from the client, okay? Or from, if it's a minor, from those who are in authority of that minor. A good rule of thumb, test that equipment prior to recording, okay? You want to make sure it works properly, because you don't want to get into a session, think you're recording, get to the end of a session, and see that it didn't record. Because it would, one, doesn't show you as being competent. You want to show competency at through all out. But it also makes the client uncomfortable in terms of you might want to say, well, can we talk a little bit more and record it again? That's not a good thing to do. So make sure you're testing your equipment. Now, in terms of the ethical guidelines that you can look at and follow, when I looked in the ethics code, The main thing, 4.03, is something you want to keep in mind, and I'll read it for you. Before recording the voices or images of individuals whom they provide services, psychologists obtain permission from all such persons or their legal representatives. Okay? Attached to that particular section, they also put in terms of 8.03 informs consent and recordings of voices and images in research. Now, I'm adding this component because although this might not be for research purposes, a lot of times the same process happens in the testing environment. You're still doing data collection, okay? So I've included that just as they have. And 8.03 says psychologists obtain informed consent from research participants prior to recording their voices or images for data collection, unless one, the research consists solely of naturalistic observations in public places, and it is not anticipated that the recording will be used in a manner that could cause personal identification or harm. Secondly, the research design includes deception, and therapy and test taking really do not include that. So, in the case of research, though, if it includes deception, you must give consent for the use of recording that is obtained during debriefing. Okay, so if you recorded that individual in deceptive because you was afraid of the results being skewed, then you must get the consent after you've done so, after you've completed that session. If they say no, you can't use it, guess what? You can't use it. Okay. In terms of talking about deception, just as a reminder, psychologists do not conduct a study involving deception unless they have determined that the use of deceptive techniques is justified by the study's significant prospective scientific, educational, or applied value, and that effective non-deceptive alternative procedures are not feasible. So now, in terms of talking about this, what comes to mind for me is how some may have been recording prior to the recording or videotaping prior to you getting a consent from the client. Here and again, what you got to be careful about is that although this is for educational and applied, are there any other type of procedures that can be made present for a client? So by just saying, okay, I'm getting in the room before they do, let me set everything up, that's not an appropriate reason why you would be recording anything prior to getting consent. So that's a practice that I would like for y'all to try not to do. Get the consent first. Safe is better than sorry. Second part of that, though, also talked about how psychologists do not deceive prospective participants about research that is reasonably expected to cause physical pain or severe emotional distress. C, but psychologists explain any deception that is an integral feature of the design and conduct of an experiment to participants as early as feasible, preferably at the conclusion of their participation, but no later than at the conclusion of the data collecting, and permit participants to withdraw their data if need be. Okay, so although that's talking about research, remember we also aspire to do well. We have aspirational as well as the guidelines, standard guidelines. So you need to aspire. So I believe the reason why they put all of that together with recording in itself can be used as a guideline in terms of, should I be coercing my clients to tell them that without this you cannot get services? No. Bottom line. Okay. So this is going to be a video in regards to how you would open up your session with a client. It discusses confidentiality, and thus I have to apologize in attempting to capture this video. Unfortunately, the sound from the video itself is mute, and thank goodness for subtitles, but you'll also hear some background noises. So I do apologize for that. And I know I'm probably talking over the video as we speak, but I did want to make mention of that as well. Okay, so let's speak about some other considerations that would be involved with clinical interviewing. And then this section is really more about you as the clinician rather than the client. First one being that Flanagans had mentioned was talking about self-presentation. They're recommending that you would choose appropriate attire. More or less, they speak about more formal dress. Um, I'm going to share my concept. In terms of how you should be, there should be appropriate attire, yes. But I'm of the notion that I also want to be able to relate to the client. And I've discovered that in working with clients, when I'm too formal, then I find that there's some level of anxiety in that they feel that I might be more of an authority figure rather than a clinician trying to help. I've discovered through my training that when I dress in more of an informal way, more of a casual way, that I'm actually able to get a client to relax more, be more open to disclosure. However, there has been reference and research that demonstrates that the more formal sense would be what clients like. Here, I would say to you, make the appropriate judgments. Your attire really is a reflection of you. So you want to be well kept enough in that your grooming is appropriate. You want to be wearing clean clothes, of course, but do you need a suit and tie? Not necessarily. One thing you want to do is look at where you are. Are you working with individuals whose social economic status is lower than where they would not be dressed in business attire and more of a casual attire? If that's the case, then you might want to make sure that your dress, although it's clean, appropriate, and suitable for business, that it's not going to uh, impede on therapy and that the client starts worrying that you are more of an authority figure rather than a clinician. Okay? You are, again, the instrument of your clinical interview. You are the first instrument that's going to be utilized. Now, Somers-Flanagan, they have a section in their chapter in which they talk about straight talk. And what they're talking about is avoiding the being too provocative or cavalier. And this really is about the therapist or clinician more so than your clients. How we dress, we don't want to give off the wrong signals. You don't want misinterpretations with your clients. You don't want them walking away from you as they had put in the text, thinking about what was that they were wearing. Okay, so what they talked about was cleavage and crotch. Uh, Not having too much cleavage, trying not to wear clothes that is too tight fitting, and there's a whole section there in speaking about things that you should avoid in trying to do this. And that's both for male and female. Okay, so I say to you, think about how you look. Look in the mirror when you're going out for the day. Jeans with holes in it probably wouldn't be considered appropriate attire. Uh, as well as tops that would show too much cleavage, you want to might reconsider. Again, even if you're going informal, you don't need to be to the point where it's overly provocative, in which it might entice a client. Where it the truth is, even though we should be able to dress any way we want, the fact of the matter is there are still going to be perceptions made. So we might want to make sure to keep ourselves in check to a certain point and think about those type of things. In regards to social behavior, now I want you to kind of realize, and you'll get this in the reading as well, is that we need to understand the therapeutic relationship, okay? Understand what boundaries are. Some of your clients might really develop an emotional tie to you. Thus, they'll consider you more like a friend than a therapist or a clinician that's trying to do an assessment. You want to make sure, again, we talked about earlier, control. You want to keep that in control in the sense of being able to express and share with them your role as a clinician. And that this is a therapeutic relationship and what a therapeutic relationship would entail. You also make sure, of course, follow those ethics codes. They'll help you all the time. And then the last thing on the slide is touching aloud. When I received my training 20 years ago, touching was considered full taboo. Okay? So what I'm going to say now is we have seen the importance of touch, but how touch is delivered is quite important. So the things you need to think about as a clinician, who is the touch for? Okay? Are you doing it for yourself, for that person, or to just impress who might be watching? That's something that Sommer-Flanagans, they speak about. Recommendations that they give is kind of a guideline that you can use. So before you want to offer any type of touch, you should be exploring different ways of dealing with the client's behaviors. Touch really shouldn't be an invasive or overbearing activity. You want to be able to make sure that the touch, when you use it, is not going to be misinterpreted by your client. And that sometimes is really difficult depending on that client. If that client had a history of sexual abuse, they can have a misinterpretation and might feel threatened by you touching them. So you want to know your client well enough and make sure you're listening and know when it would be appropriate to even ask if touch is allowed. And I'm going to give a quote from the text. Sexual attraction to clients is almost a universal phenomenon among therapists. However, most, of course, do not act on that affection and work to handle their reactions in a responsible manner. Now, a reason that touch can be scrutinized the way that is because the client might experience your touch as something more intimate or romantic. So you want to be careful of that. You don't want no sexual overtones to be included with that touch. So utilizing touch can be okay in the right situations. And how you give the touch. Would you, for example, people have a big habit of when they're talking to someone, and I've noticed it in the media, and I've noticed it through different therapeutic situations, that they might want to touch one's knee. I would not deem that to be something appropriate because it can be misinterpreted. I've used touch in the sense that I do what I call the side hug, touching in that manner, where we're actually not facing one another, we're side by side, and I might give a touch in that manner, or a hand to the shoulder. But again, you want to make sure you're gauging, and sometimes it's difficult to be able to tell, but you want to be careful in doing that, okay? Because number one, we have to make sure that it's something that's accepted by the client, that we're not breaking any ethical boundaries because that touch is really for you and not for the client. All right, that can be considered something as an abuse, and guess what? Abuse is illegal. So terminology in terms of talking about sexual relations between the therapist and clients, you have to avoid that sexual abuse. The Sommer-Flanagans give a scenario as if they're saying, think about if you're working with a client, you might feel a sexual attraction. So you might say, I feel sexually attracted to you. How do you suppose that disclosure might be interpreted by the client? So in speaking of sexual attraction, is nearly always going to be laden with that flirtation, and you want to be careful of that. If you find that you're attracted to your client so much so that you cannot uh, compartmentalize and move that flirtation and those feelings of attraction away and be able to get to the job at hand, bottom line I'm going to say is you have to take control. And if that is where you think these feelings are going to wind up exploiting against your clients, then go ahead and refer that client to someone else. You don't need to have that happening, okay? And do seek out guidance from your supervisor in terms of that. We are human. Things do happen. So you want to really be cognizant of how you are handling the situation during the clinical interview, during the assessment process, how you're reacting, and how you are, again, an instrument of the assessment. So, in terms of talking about clinical interviewing, I'm going to stop here for today. This is something we'll be talking throughout. Please do look out for the next video.